So, what about New Zealand? Obviously, lots of similarities and similar issues, similar patients, in some ways similar primary care structure, I gather, although differences and different structures and different nuances. We feel that to really be effective, there needs to be a proper strategic plan. We talked about this with Simon several times. Lots of people pick out bits, but it doesn't work when you pick out bits. To really work, and where in the 4 nations of the UK, it's really worked well when there's been a strategic plan for embedding care. And it needs local ownership and adaptation. It definitely needs to be locally owned. It needs to. In Scotland, they had GSFS Scotland, and they tartanised it, and other countries, other areas need to do that. So I was talking to Joe earlier about ways of developing ownership and adaptation, so it becomes their idea and their solution and their way forward. Because no one likes something that's imposed. But the good thing is that some of these things, instead of reinventing the wheel, some of these things have been tried and then can be tweaked and used. So we think it's much better to take it as a composite whole rather than bits. When you take out bits, it just doesn't work so well. And we've seen this a few times. St Christopher's, who's our first, St Christopher's Hospice in London, is our first regional centre with GSF care homes, and they say very much that they mustn't tweak it. Just a few minutes. We developed this over 12 years ago. It's much better now, working much better, so we suggest you learn from our mistakes. We made lots of mistakes, so-called mistakes, but you always learn from them. And then one of the questions is, would this work in primary care, in ACS care homes, or in hospitals, or cross-boundary? In some senses, the aged care facilities are really easier because they're little microcosms, and you can introduce them, and they sort of tend to work. But then you've got to look at the wider community as well, so that would be up to you. But I know, we've had lots of contact with lots of people in New Zealand over the years, and they've picked up bits and things and talked about it with us. So key points finally, GSF is a whole system quality improvement framework. It is whole system care. It's trying to look at a whole lot of different factors, bringing them together. The key areas: identify the 1% of the population and develop a proactive plan of care, identify, assess and plan, and assess including those discussions, the advanced care planning discussions. Thirdly, there are lots of training programs now. At the more, I haven't actually mentioned all about the prisons and the children and the community hospitals and the others. But the care homes accreditation has been most fully worked up over the last 7 years with accreditation, but we're now going back to primary care and developing accreditation and doing the same for the others. And the vision would be cross-boundary integrated care, the next big goal, so that it starts to really work in a whole area. And that's it. Website at the end and information. It's been very odd talking to myself here. I'm very glad that Simon occasionally can't leave it. Sorry if it's been fairly intense, but I just wanted to give a bit of an overview, really, of the kind of background to it and the kind of things that we can support others with. And I must say, over the next few years, we'd love to do more internationally. We're already doing bits, as we say, but to be able to use this in other sectors and settings and hopefully benefit patients there as well would be great. Thank you.